August is National Breastfeeding Awareness Month, and Amy Ranke with Women's Care Florida joins us to share her knowledge and advice about breastfeeding. And Amy, welcome. How are you?
Thank you. I'm good.
I'm excited to talk with you today because, again, breastfeeding is something that's either in the headlines or maybe you're enduring it, maybe people are talking about it. It is everywhere.
Yeah.
And so it can have a lot of myths, some truth, some fact. We're here just to kind of educate people, right?
Definitely, yes. A lot of people think it just comes naturally, but for most women, it really doesn't. So that's why we're here to help you.
Well, let's talk about first the myths. Again, I think people, you get pregnant, you have your child, and you see it on TV, it's easy peasy, right?
Right. Sometimes it is, and that's wonderful and beautiful for some moms, but a lot of times it's not. So we really try and start educating moms prenatally. So in your visits, when you come to us, we try and just start bringing up the topic, asking you like what your goals are, if you want to breastfeed, if you don't, and we really just honor that. We don't try and sway you one way or another. And then we recommend you going to like a breastfeeding class, kind of towards the end of your pregnancy with like a childbirth education class. And then once you deliver in the hospital, most of our moms are seen by a certified lactation consultant, which is super helpful. And then we always have in our office a midwife on call 24/7. So if you ever have a question or need advice or just someone to tell you that you're doing a good job, because most of the time that's what moms need, is just someone to tell them that they're doing it right. So they can always call us, and then we see them postpartum like 1 to 2 times, and then if they need extra visits, they can come in for that too. So, but yeah, we just like to tell people that just like pregnancy is a journey, like breastfeeding is its own separate entire journey of itself, and you do need someone to kind of hold your hand through it.
Well, I'm so glad that you just said that sometimes you just need to have someone say a good job, because it's already such an emotional time after you have a baby, then add sleep deprivation into the mix, and then you're trying to make breastfeeding happen, and you do talk about sometimes that it's not as easy and the struggles.
Yeah.
So giving that good job, but also when do people need to know it's normal, it's not normal, I need to seek help?
Right.
What advice would you give in that?
Right. I would just say that we really want to try and prevent issues from happening. So if you, even on day one, are wanting help, I do think in the hospital, always ask your postpartum nurse. So before I was a midwife, I did postpartum nursing, which is kind of how I fell in love with lactation. And I tell moms it's like a 3-person job to breastfeed those first couple of days. Like you need someone else there helping position the baby and look at the latch and all of that. Once you get home, if you're experiencing pain or just honestly needing someone else just to kind of bounce ideas off of or things like that, ask a friend, call our office. We can have you come in, sometimes even that day for an appointment if one of our providers has an opening. Or there's tons of local resources for certified lactation consultants that have like groups. La Leche League is a really popular one. They have meetings honestly every day of the week depending on where you live. And then private consultants who will come to your house. So really, I just want to tell moms, like, there is help out there. You do not have to struggle at home by yourself.
We've got a month left too, and I always hear about struggles with the breastfeeding components, but then also pumping, which can open up a whole other different issue. Again, we only have about a minute left. What are your thoughts on pumping and what people need to keep in the back of their minds?
Right. I would say I just like to dispel the myth that you don't have to have a freezer full of milk when you go back to work. So even you just need to start pumping around the 6-week mark. Our breast milk isn't established until then, and so you really just need a few days of milk stored up. So that's what I would say.
That's a good one, because you do hear that. Again, you hear the myths around this. So I'm so glad that you're here. I'm so glad that you talked about the immense amount of resources that you have to help women with this.
There's so much help, exactly, And I also just want to say that if you do choose formula, we also honor that. We trust our moms and we like to educate them on the options, but it's totally their choice and we're not going to sway them. So.
Yeah. I love hearing that. It was so nice to chat with you today.
Yeah, nice being here. Thank you. Yeah.
And as always, if you want more information from Amy, possibly about breastfeeding or anything else that Women's Care Florida can help you with, womenscareflorida.com is the website, as you see right there on your screen.